Bismillahirrahmanirrahim. I'm your instructor, Dr. Aruj Hamid. The course is Current Trends in Biochemistry, and today's lecture topic is depression. First of all, we know about what is depression. Depression is actually a mood disorder that can affect a person's daily life. Mood swings of the patient causes the depressive behavior in the life of that person. Depression is not a very lethal disease, but it can be persist for months to years in the life, threatening for the person. What is the symptoms of this disorder? Its symptoms consist of persistent feelings of sadness and hopelessness, anger, loss of interest in the activities you normally enjoy in your life, difficulty in sleeping, the sleep is lower down, or maybe sleeping is too much, weight gain or weight loss, extreme fatigue in the body, anxiety, restlessness, frustration, or irritability, difficulty in concentration during their physical and mental activities, making decisions, or remembering anything. If this type of symptoms persist for 6 months to a year, it can be lead to the thoughts of suicide or even of death. It is also related to the behavioral changes between the person's mental condition, and it is related to many of the diseases. Depression comes out of due to in case of other diseases which is occurred in the body. When persons are suffered from the contagious diseases and from the life-threatening diseases, for example, diabetes, cancer, AIDS, hepatitis, and also nowadays the COVID-19, which is leads towards the depressive mood swings between the persons. Even normal person can we change their behavior due to the depressive moments which comes into the mind by time. Depending upon the situations which created during their lifestyle, during the journal behavior, the persons feels that they can be they can be at the risk of death, but this is not a leading cause of the death. Depression is not a cause of death. It is only the mood swings which is occurred between the patient's mind due to the very critical situations present in their daily life. But it can be changed somewhat. Depression can be changed the brain function. How can it change the normal brain function? Hypothalamus of the brain is damaged due to the changes in the behavioral or moods. In case of feelings of sadness, restlessness, hopelessness, the cortisol level of the hypothalamus is increased. This cortisol is released when you are in stress condition. When the high level of cortisol is present, it slows or stops the growth of the neurons, which leads to the memory loss, memory problems. Also, the other part of brain, amygdala, it is a part of brain which is associated with the emotional responses of the persons. This part of brain is enlarged during the depressed condition, during the depression episodes. It causes the disturbance in sleep, changes in activity levels, and changes the hormones of the other hormones which are produced by the brain to be changed. And by these changes into these hormones which are related to the mood and the behavior of the persons, the damaged amygdala is cause the depression in that persons. Third one is the brain inflammation. In case of depression, the brain is inflamed. Inflamed brain is interfere with the neurotransmitters of the brain, which are used to regulate the mood behaviors, such as serotonin. The serotonin level of the brain is lower down due to the depression episodes. Last one condition of the brain functioning is the hypoxia. Hypoxia is the condition of low level of oxygen present in the brain. The oxygen given to the brain is lower down, which leads to the inflammation of the brain. And this leaded inflammation can regulate the changes in the mood swings. Not only it is restricted to that symptoms which are later on which are previously discussed, but also it is leaded to the other diseases like heart disease, like gastrointestinal disturbance, stomach aches, indigestion, nausea, cramps, or bloating in the stomach, which are also the symptoms of depression. Now, what is the types of depression? There are many types of depression depending upon the conditions and severity of the depressive episodes. First one is the major depression disorder. Major depression in case of major depression disorder, the person feels hopelessness, feeling of sadness, feeling of difficulty in concentration, making decisions, remembering, and thoughts of death comes into the mind. They may be frustrated, they may be of anxiety, they may be feel extreme fatigues in their body, and their body weight lower down. Second type is manic depression. Manic depression. In this type of depression, the episodes of depression are lead to upheld mood episodes and to low-held mood episodes. When the person feels very much for a short time, they feel very depressive and very anger full of anger, but with the passage of time, this is coming towards the coming towards end, and the mood behavior of the person is better by due to some for some time, and this period is of short periods, 30 minutes or of 1 hour. To treat these different types of olanzapine drugs are used, lithium drugs are used for the control of this depression behavior. Third type is seasonal depression. Yeah, definitely depression is of seasonal type also. What means by seasonal? Seasonal means when the season is of winter, then this depression come into the mind of the patients. In winter, when days are short and nights are long, the persons are not get the huge amount of light, so they feel depressive in their mood, they feel sadness in their mood, and this seasonal disorder is the depression disorder is only for that period of winter intervals. After when the winter is and in the summer and in autumn and other spring seasons, this type of disorder is come to an end. And if this can be cured by sitting into the highlight areas for some time and for the in the natural environment, it can be come into end. Fourth type is psychotic depression. As it is shown by the name, this type of depression is related to the psychotic symptoms present within the patients, hallucinations, saying or hearing the dead things which are not actually occurring, which are not actually present, relations, false beliefs of the person about the some situations or about some things, paranoia, belief of harmness from the others can be harmful for them, postpartum depression. And this psychotic situations comes into mind, it leads to the depression of that person. Next type is postpartum depression. Postpartum depression is related to the patients, female patients which gives childbirth, and after childbirth period they feel depression in their life for approximately 1 month to 40 days. And this type of depression comes at end after this time period is completed. Next one type is the situational depression. This situation depression is related to the situations that occur between within the life of that person, the death of the loved ones, any type of an accident, or any type of sadness behavior, any type of unbelievable changes in their daily life, or the joblessness can also be leading to this type of situational depression. And this depression comes in mind when this situation occur, and it remains for that period when that situation persisted. When this situation is come to at end in the life of that person, then this situational depression is also come to an end. Last one is the atypical depression. Atypical depression. This depression is called as atypical depression because it is only related to the changes in the hormones and neurotransmitters that regulate the normal mood behaviors of that person. Without any reason. It can be occurred at any time, at any intervals of, it may be leaded from 30 minutes to years. This is all about the different types of depressions. What type of treatment can be given to the depression? Treatments given to depression is very much related with the treatments given to the anxiety disorders. The change in the behavioral therapy First of all, the behavioral therapy is given to the patients. It means the behavioral changes if they feel depression about a certain type of situation, about a certain type of things, and if they think about that this thing is not occurred in their life, and they are come to from that situation, then this depression can be ended. And by taking a healthy walk, by taking a healthy diet, by taking a change in their mood behavior, by taking a bath, by taking different types of vitamins in their diet, they can become come out of these depression moments. Second one is the drug therapy. In case of drug therapy, many types of antidepressive drugs are available. Antidepressant drugs are available which can be used to increase the level of serotonin within the body. So by changing this level of this serotonin neurotransmitter, the body's mood behavior is changed and these depressive movements are come to an end. Many type of antidepressant drugs are available. Some of them are Celexa, Lexapro, Prozac, Paxil, Zoloft. Well, by taking these drugs, the patients feel healthy and they get long sleep, and after that long sleep, the depressive mood behaviors come into mind or come to an end. But definitely these drugs have side effects, and these side effects can changes the other these drugs have many of the side effects, and the major side effects which are caused by these drugs are the changes in the stomach, indigestion, stomach aches, nausea, cramps, or bloating within the body, the gastrointestinal disturbance. Rather than this drug therapy, the natural remedies can also be used to cure these depression situations. Third therapy is the natural remedies. Natural remedies, when the body's vitamin D level is lower down, the persons feel the high depression in their moods. So by taking the diets which contains the high level of vitamin D rather than the supplement of vitamin D, then this depression episodes can come to an end. And these are cereals, juices, milk, and canned fish are rich in vitamin D. They contain high amount of vitamin D, and by taking this high amount of vitamin D, the persons are come out of these depression behaviors. Second is turkey, chicken, or meat, which are rich in the protein. They are rich in protein diet, and this high protein they contains the high level of tryptophan. Tryptophan is actually used for the production of serotonin between the body. This tryptophan, a high level of tryptophan in these products can lead to the high production of serotonin, which leads to the change in mood behaviors, and these depression episodes are come to an end. Next one is basil nuts. especially the basil nuts, but also the sunflower seeds, seafood, brown rice. They are high in selenium content, and this selenium content is used to reduce the free radicals which can cause depression. High level of free radicals or reactive oxygen species present within the patient's body can lead towards the depression. And by using these basil nuts, sunflower seeds, seafood, brown rice, it can are rich in high selenium levels. They contain the high selenium level and they used to sequence the ROS reactive oxygen species present in the depression patients. By taking these natural remedies, the depression disorder can be ended. Next is carrots. Carrots, pumpkin, spinach, and sweet potatoes are high in carotenoids. Or beta carotene. Carrots, spinach, pumpkin, and sweet potatoes are rich in carotenoids, especially the beta carotene. Beta carotene or carotenoids are also used to sequence the reactive oxygen species, and by sequencing these reactive oxygen species, the depressive movements are come to end. So they are also helpful for the depression therapy. Next is deficiency of vitamin B12. The deficiency of vitamin B12 in the patients of depression, it leads towards the depression. Vitamin B12 deficiency are used to process these are actually produces the S-adenosyl methionine. Vitamin B12 is required for the production of S-adenosyl methionine. S-adenosyl methionine is used to process other chemicals that affect your mood. The toxic chemicals can be processed by using this S-adenosyl methionine, and this can be produced by the vitamin B12. And if the vitamin B12 level of the patient is lower, then it leads to the depression. Seafood, milk, and eggs are rich in vitamin B12. So by using these natural remedies, we can get rid of depression. Next one is the coffee. Research shows that coffee is very effective to motivate the depressive persons. It helps you feel more motivated. So that's why the take of one cup of coffee daily leads towards the end of depression. Folate deficiency also leads vitamin B9. Folate deficiency also leads to the depression. But if we take leafy green vegetables, in your daily diet, then this deficiency not occur and the depression can be come to an end. Fish. Last natural remedy is the fish, which contains the high level of omega 3 fatty acids. Omega 3 fatty acids are also used for the sequencing of free radicals, and it leads to the end of this depression behavior or depression disorder. By increasing different vitamins and by decreasing the level of cortisol, by decreasing the level of cortisol, by increasing the intake of these different types of vitamins, high intake of vitamins in diet, can lead towards the high production of serotonin. High protein rich diet also leads towards the high level of serotonin. Tryptophan converts into by the tryptophan kinase enzyme. ATP is converted into ADP and this is converted into serotonin. Serotonin is the neurotransmitter which leads to the lower production of cortisol, and the mood behavior of the patient are changed by this high level of serotonin present within the body. That's all about the depression, the biochemistry behind these depression disorders. I hope you understand all the facts and figures about this depression. If you have some questions regarding this lecture, regarding this depression disorder, you can ask me by giving comments or you can ask me by email. Thank you so very much for that.